Hi, I'm Dr. Peter Bronsky. I'm a board-certified specialist in orthodontics with over 35 years of experience. I'm an expert in the diagnosis and treatment of orthodontic problems, and we have patients from ages 4 to 84. The word doctor means to teach, and I feel like the idea of a thorough evaluation of every patient to make sure you have a proper diagnosis and treatment objectives and then treatment plans has been bypassed, and people are just wanting to wait until all their teeth come in and then have their upper front teeth straightened and not really look at problems that could be more developmentally related. And I find that parents that bring their patients in to my office say that I don't really like the space between my child's teeth, or it looks like they have some crowding, and I go for 6-month cleanings with my child every single time, and they say you don't have any cavities and it looks like you're doing a good job cleaning your teeth. What I'm here to tell you is that that doesn't mean your child is not at risk for severe dental health problems, and many of those problems are related to the way the jaws have formed and the way the teeth are erupting. You can have top and bottom jaws that don't match together. You can have an upper jaw that's narrow that results in breathing problems, biting problems. You can have adult teeth that are blocked from coming in that can become impacted and damage other teeth. And you can have a combination of all of those. And what you need to be focused on is that young people are developing in an accelerated way 2 to 3 years ahead of one generation ago. There was a young lady here today who is 8 years going on 9, and she has what used to be considered 12-year molars that are coming in. So what I recommend every person do is go for a dental checkup every 6 months, have a dental cleaning. I recommend that everyone bring their children in at age 7 for an orthodontic evaluation. To reduce any barriers to coming, we do complimentary evaluations, complimentary panoramic x-rays, we take measurements, and then I study everything, and we have a meeting. And at the meeting, I go through how their jaws are developing. Are they distorted? Is their bite developing correctly? Is there enough room for their teeth to come in? And then by doing it at age 7, we have usually their adult molars are in and some of their upper front teeth are in, and then we can do an assessment to see whether or not the adult teeth are able to come in, whether their jaws are forming correctly, whether their bite's forming correctly, and if they're not, we can then come up with a set of goals to correct those jawbone, bite, and tooth eruption problems so they don't become more severe over time, because orthodontic problems don't get better on their own. I hear every day people say, oh, I was told I can wait. Wait for what? Wait for everything to get worse? Wait for a distorted upper jaw that doesn't match with a lower jaw? Wait to need surgery? Wait to have adult teeth that need to be surgically exposed because they've damaged other teeth? Having jaws grow unevenly because of cross bites? Clinical examinations by a board-certified expert will allow you as a parent to know what the problems are and what the recommendations are. And that's why the American Association of Orthodontists suggests that everyone have an orthodontic evaluation by a specialist at age 7, because they are the experts in orthodontics. And since everyone is focused on the advertisements on television that deal with clear aligners, they think, well, we'll just wait until all their teeth come in, and then we use clear aligners and some kind of magic will happen and their teeth will be straight. Well, what if they have a jaw problem? What if their jaws don't match up? What if they have a bite problem? Clear aligners are not effective in doing that. What if they have so severe crowding that they have impacted teeth? Clear aligners don't fix those, so you have to work in a preventive way for people that have jaw problems, bite problems, and tooth eruption problems, and the best time to evaluate that is at age 7. So yes, going every 6 months to make sure your child doesn't have any cavities is critical, but that doesn't mean that they're not at risk for severe dental problems like orthodontic, bite issues, jaws that aren't developing correctly, teeth that can't come in. And the worst feeling, I think, for adults is for them to be remorseful. Oh, I wish I would have known. Well, everyone can come to my office at age 7 and have their mouth evaluated, so they will know exactly what the status is and whether or not treatment is needed or treatment is not needed. But you don't want to be remorseful as a parent. Oh, I wish I would have known. Or don't people wait until all their teeth come in and then have them lined up? That's an old-fashioned 1950s perspective of orthodontics. Contemporary orthodontics includes evaluations at age 7 to determine if they have jaws that are developing correctly, teeth that are erupting properly, and bites that are developing. And I think it's super critical and should be a mandatory part of everyone's dental evaluation.